Bismillahirrahmanirrahim. In the name of Allah, the most gracious, the most merciful. Quote of the day is dream as you will live forever, live as if you will die today. James Taine. Assalamu alaikum everyone. I'm Dr. Mahnur Khan. I am PG in the Department of Community Medicine, and today I'm going to present on the topic of national health policy under the kind supervision of my worthy professor, Dr. Saira Afzal. Learning outlines. In this presentation, we're going to learn the health policy formulation, health policy 2001 and 2009, policy centralization, recent updates, and MCQs. At the end of the presentation, participants would be able to describe the health policies of Pakistan, and also about policy standardization. So what is health policy? WHO has defined health policy as the decision, plans, and actions that are undertaken to achieve specific healthcare goals within a society. Harvard Medical School describes several categories of health policy, such as personal healthcare policy, pharmaceutical policy, policies associated with public health, such as vaccination policy, tobacco control policy, and breastfeeding promotion policy. Spectrum of area covered by health policy are health policy may cover topics of financing and delivery of healthcare, access to care, quality of care, and health equity. Policy cycle. First of all, agenda is set, which include the foresight scanning, identifying the emerging issue. Then formulation is done, which include the impact assessment. Adoption is done, includes the support and advice to regulatory bodies. Then implementation is done, which is independent verification and methodological guidance. Then evaluation is done, evaluation of efficiency and effectiveness is seen, and at the end, the support maintenance, which includes the crisis response and feedback to update. And according to feedback, the new agenda is set. Objectives of national health policy. It achieves an acceptable standards of improved health, ensure equitable access to public health system, create new health infrastructure in areas deficient, upgrade existing health infrastructure, promote public-private partnerships, suggest ways to increase investment in health, promote stewardship in health for effective monitoring and evaluation of current policies. Potential role of government in healthcare. Government is a regulator of healthcare policy, is a stimulator of research, is a protector of deprived group and financier of health and healthcare program, and is a purchaser of healthcare services and direct provider of services. Health policy triangle developed by Walt and Galson. Four elements of a policy analysis are context, why the policy is needed; content, what is the policy mainly about; process, how was the policy brought forward and implemented; and at the end, actors who participated in and influences formulation and implementation of the policy. So here is the Walt and Gilson triangle. Here we can see the context, which includes the stimulation factor, political condition, culture factor, text, and actors, which include the state, the market, etc., the process, policy formulation, or policy implementation, challenges in implementation, content, which include the objectives, aims, assumptions, implementations. Here is the a triangle again, where we can see the context, the socio-political, cultural, and health system context within which the child to adolescent mental health policy was developed. Then there is actor, the range and characteristics of participant, individuals, group of organization in the policy development process, including their roles, relationship, interests, agendas. The process followed to consult with key stakeholder across the government sectors, health, social care, education, non-government sectors like relevant civil organizations. And context in this scenario is the objective value vision service models, guidelines, and implementation plans of child and adolescent mental health services outlined. Steps of healthcare policy formulation. First of all, data collection from HML is done. Preparatory meetings are done. Draft sent to Planning Commission and Ministry of Finance. Cabinet is formed. 5-year plan formulated. Project is designed. Public sector development program is done. Implementation and then monitoring and evaluation. Five basic criterion. The board committee reported have discussed the acceptance and accuracy of policies document on that basis, highlighted the five basic criteria the policy should contain. The first one is empirical record of the past, situational analysis, need of assessment, future plan with implementation and estimation. Evidence or evidence-based reliance on burden of disease, address health system with intersectoral approach, look into cost effectiveness of goals, objectives, and targets, have a clear definition of roles of federal, provincial, and district. Formulation of health policies in Pakistan before 18th Amendment process was the Federal Ministry of Health and Planning Commission. Planning and implementation was done on the provinces level. After 18th Amendment, which was in 2010, devolution was there, and National Health Union Health Policy is functional for all provinces. Health Policy 1990, it includes a Pakistan a signatory of Health for All. First national policy was formed in 1990, focused on school health services, family planning, nutritional program, malaria control program, control of communicable diseases, sanitation, and safe drinking water. The second policy was made on 1997. SAP was implemented in 1992. Multi-sectoral policy initiated for Government of Punjab. Second national policy and health promotion and education was the main targets. Non-communicable diseases were highlighted for prevention and control measurement. The third health policy was made in 2001. It was to create mass awareness in public health matters and use multimedia to disseminate information, omit prevention and control aspect of non-communicable diseases. A heartfelt 2003 National Action Plan for Prevention and Control of NCDs was made. Health Policy 2001, here the limitations, empirical record of past situational analysis and need of assessment wasn't given. Evidence-based reliance on board was not given. Address health system in intersectoral approach and cost effectiveness of goal, objectives, and target wasn't mentioned. Clear definition of roles of federal, provincial, or district level was not mentioned. Health Policy 2019 was the fourth policy. Draft not approved, stepping towards better health. Vision was to improve health and quality of life for all Pakistanis to make progress towards health-related Millennium Developmental Goals. It was to enhancing coverage and access of essential health services, especially for the poor, which through the primary and secondary healthcare facilities and primary and preventive healthcare programs. The second goal was to measurable reduction in the burden of disease, especially among vulnerable segments of population. Third was to protecting of poor and underprivileged population subgroups against catastrophic health expenditures and risk factors. Fourth was strengthening health system. Fifth, strengthening stewardship function in sector to ensure service delivery and equitable financing and promoting accountability. Sixth goal included the improving evidence-based policy making and strategical planning in healthcare. Healthcare Policy 2019 and 10. Here, the limitation empirical record of past situational analysis and need assessment wasn't identified, and evidence-based relying on board address health system in intersectoral approach, cost effectiveness of goals and objective didn't mention, clear definition of roles of federal, provincial, or district level mentioned, but district health system role not clearly defined. Health Policy 2010, Health Policy 2010 could not be approved before devolution post 18 amendment in 2010. Formulation of effective health policy. Details for the effective health policies can be formulated by doing the following things. First, situational analysis and policy formation. Second is to increase the funding. Third, training and capacity development. Then, community involvement, stabilizing the population, monitoring and evaluation, transparency and accountability. National Health Vision 2016 to 2025 background issues partial implementation of National Health Program 2001 to 2009 policies many health issues burden of disease worsening of population explosion and insufficient health system was identified remained unresolved plus new challenges created by 2011 health evolution Millennium Developmental Goals were not achieved and SDGs were launched. Punjab Health Sector Strategy. The government of Punjab taking forward the intent of newly elected political leadership to reform and restructure the Punjab health sector towards better performance has pursued and development of 10-year Punjab health sector strategy 2019 to 2028. The strategic roadmap being a basic requirement to tie the financial resources to intent has been developed with valor and rigors. The strategy is sequelae to and is in consensus of achievement and gap filling out from the previous health sector 2012 to 20. Health Sector Strategy 2012 to 20, Punjab Sector Strategy 2019 to 2028, Millennium Maternal and Child Health, Nutrition and Family Planning, preventive health services including communicable and non-communicable diseases, includes the patient safety and quality care, includes the medicine and biomedical equipment, include health disaster management and emerging medicine. Healthcare financing, public-private partnership includes HMS, governance and accountability, HR for health. Is the health sector strategy sent? The approved health sector strategic frame 2012 to 2020 of Sindh is expected to serve as an overarching umbrella for guiding operational plans of medium and long-term programs and projects. Implementation of the strategy requires PKR 318.7 billions. Development plan and expenditure forecasting. The strategical framework has also been developed to identify the requirement for health system strengthening in Sindh, innovative finances scheme and responding to stewardship and government role of the government. Currently, an operational plan for implementation of health sector strategy is in progress with support of technical resource facility. Furthermore, government of Sindh has allocated 56 PKR billion for health sector for fiscal year 2013 to 14, out of which is estimated that 64% will be used for funding routine health operations of public health sector, for example, salaries, cost of medication, and etc. Is the health sector strategy Khyber Pakhtunkhwa. After devolution, Khyber Pakhtunkhwa is the first province to develop health sector strategy 2010 to 2017, entailing a responsive health system to improve the health status of population based on prioritized outcome. It approaches focuses on enhancing the coverage, improving human resources management and government and regulating the health sector. Implementation of minimum health services delivery package for primary and secondary level will maximize the outcome. The health sector reform unit of province is taking the lead of these reforms. A robust of monitoring mechanism headed by sector is already operational. The cost of priority health measures to be taken over a total 7 year is budgeting 106 billions. It is imperative international support which is 49 billion. It is imperative that international funding is secured so that the pace of progress is maintained by existing mechanism and improved government. The This need to be backed by high level political commitment so that targets were achieved within the given time frame. The health policy was prepared in view of the key issue related to health status of the population, intersectoral coordination, priorities, and current government in health sector, achieving health-related SDGs and universal health coverage, national priorities, and health sectors. Health sector strategy Balochistan. Health sector strategy Balochistan 2013 to 2018 and health policy 2018 to 30. This was perceived by reviewers of literature published as well as great to establish policy context. The policy has been developed through a consultative process involving stakeholders, and for that, field visits, individual meetings, and key information and group meetings and focus group discussions were held. The principles of health policies are embedded in National Health Vision 2016 to 2025 and a Sustainable Developmental Goal 2020 to 30. The health policy document will provide direction and serve as long-term plan for health system strengthening. Health sector strategy Gilgit-Baltistan. National Vision for 10 Priority Action to address the challenges of reproductive, maternal, newborn, child, and adolescent health and nutrition. Here is the summary. First policy was made on 1990, then second 1997, then 2001, 2009, and then 2010, where the devolution occurred and new were made, which national health policy, which were started from 2016 and will be continued to 2025. Policy standardization. Standardization in healthcare is often defined as the process by which healthcare products and services are chosen by committee of the key stakeholders considering the evidence-based research to ensure quality patient care while adhering to fiscal responsibilities. Standardization, especially in healthcare, minimizes the risk of errors, increases the patient safety, and can actually improve the patient experience. Berkeley Public Policy Journal. Plans are now sold through the health insurance exchanges, either set up by a state or run by the federal government. Instead of allowing the insurance to offer a vast range of plans, plan standardization streamlines decision making to the benefit of both consumer and insurer should be there. State-based and federal marketplaces can and should recognize the existing evidence support standardization and offer standardized plan that benefit the consumers by reducing the complexity of decision making and buying insurance. By standardize and improving the consumer experience with Affordable Care Act coverage. The Affordable Care Act coverage created health insurance exchanges in every state of to encourage the insurers to compete based on price and quality. The exchanges were required to maintain website where consumers could make apple to apple comparison among health plans and shop with the confidence that plans available had been certified as meeting a minimum level of comprehensiveness and quality. States were given the primary responsibility to certify that participation health plans meet federal standards, as well as given flexibility to set additional plan standards of their own, such as requiring insurer to offer plans with standardized benefit designs. Now we're gonna discuss recent updates. This article was published with the title of Does Improvement in Rural Infrastructure Contribute to Alleviate Poverty in Pakistan? A Spatial Economic Analysis. This study aims to empirically analyze the impact of rural infrastructure on district-wise poverty in Pakistan. The analysis provides us some important conclusion and policy implementation for poverty reduction strategy in Pakistan. From a policy perspective, the findings suggest that the government should take appropriate measures to overcome energy poverty in rural areas, as more than 35% of rural areas in Pakistan have no access to modern form of energy. The government may have to ensure an efficient implementation of national sanitation policy 2006 and National Drinking Water Policy 2009 to achieve the targets by 2025. Hence, the study may provide the evidence informing the debate on the role of public infrastructure investment in developing the country. The second study was titled as the policymaker perspective about the e-government success using HP approach policy implications towards the entrenching good governance in Pakistan. This study fills the gap caused by the paucity of literature in terms of empirical based techno-policy research in e-government domain from implementation perspective. Further, it serves as a prototype for the prospective researchers who aim to conduct the policy-oriented research towards e-government development in their respective regions. This study contributes in several ways. It highlights the significance of e-government as a technology for attaining good governance in Pakistan. Further, it represents the consolidation view all the concerned stakeholder towards the successful implementation of all e-government programs in Pakistan. Finally, it provides a guidance for the government agencies to formulate their e-government policy and strategy as per the needs of stakeholder in Pakistan. Now, there is the MCQ section. The Health Ministry XYZ wants to analyze the current challenges present in National Aid Control Program and revise the overall policy. Which of the following option is the correct step-by-step pathway used for such policy analysis? A. Data collection from many sources and implementation of health policy using scientific approaches to problem solving. B. Analysis of a problem and policy to determine the best way to implement changes. C. Assessment, planning, intervention, and evaluation of health policies and procedures. D. Identifying a problem, analyzing the policy and problem, developing the policy, implementing the evaluating policy. E. The data collection from one source, analyze it with the help of a statistician and policymaker.
C. Assessment, planning, intervention, and evaluation of health policies.
And this answer is B. Analysis of problem and policy to determine the best way to implement change. MCQ number 2 is our teacher XYZ addressing to a group of students had an interactive session on the topic of health policy analysis. He asked the student to choose one best statement that describes a question one might ask in analyzing health policy. A. Who will benefit from the health policy? B. Who can we implement with this health policy? C. How has this health policy been utilized? D. Are there any changes that need to be made for this policy? E. Who will give the support to policy? Answer is A. Who will benefit from the health policy? MCQ number 3, a very key point in the process of COVID-19 contagion control is the introduction of effective policy measures whose results must be noted continuously through the accurate statistical analysis. When a dedicated group keeps continuous oversight of activities, ensure that they are proceeding according to plan. So they are doing A. Monitoring, B. Recording, C. Planning, D. Evaluation, E. Calculating. Answer is A. Monitoring. Yes, A. MCQ number 4. In an era XYZ, after situational analysis and need assessment, a public health team has developed public health policy according to guidelines, during which one of the given phases most challenges are faced: A, policy development; B, policy implementation; C, policy evaluation; D, policy monitoring; E, policy stakeholders. Answer is B,
Policy development.
policy implementation. MCQ number 5. Maternal mortality relation is a key performance indicator for efforts to improve the health and safety of mothers before, during, and after childbirth. A public health professional team wants to design a policy to reduce maternal mortality rate in Balochistan. What should be done? First, policy making. A, need assessment; B, intersectoral coordination; C, financial approval by Ministry of Finance; D, 5-year project; E, implementation. Answer is A, need assessment. MCQ number 6. In Pakistan, health system management and decision making has been transferred to district level, and ADO can hire, manage, budget, and service provision. Which type of decentralization is this? A, deconcentration; B, delegation; C, devolution; D, demographic dividend; E, demographic trap. It is answer is C, devolution, which was done in 2010, discussed previously. Question number 7. Health Policy 2009 was made according to need assessment, addressed health system in intersectoral approach, and discussed cost effectiveness of goals, objectives, and targets. What was it not implemented in Pakistan? A, lack of political will; B, intersectoral international pressure; C, devolution; D, delegation; E, lack of community participation. It's also been discussed. The answer is C, devolution. Question number 8. BHU service up to 25,000 people with basic medical and surgical care, preventive services, maternal and child health services, financial management of curative and preventive services at a basic health unit in Pakistan is being managed by A, national level; B, provincial level; C, international level; D, World Health Organization; E, UNICEF. Answer is B, at provincial level. MCQ number 9. Neonatal mortality rate for Pakistan is 40.2 deaths per thousand live births. World Health Organization wants to sign an agreement that will help Pakistan to reduce neonatal mortality rate, as Pakistan has the highest neonatal mortality rate in the world. The agreement is function of A, national level; B, provincial level; C, district level; D, union level; E, departmental level. Answer is A, at national level. MCQ number 10. The decentralization of health system has played an important role in health system of Pakistan. Which of the following is incorrect regarding the decentralization? A, improves allocative efficiency; B, improves quality; C, service delivery is according to equality; D, increase production efficiencies; E, focuses on maternal and child health. Answer is C, service delivery according to equality. Here's the key of MCQs. Here's our YouTube channel where the all presentation are being uploaded. Kindly like and subscribe. Thank you.